Hey guys, welcome back. I have a special guest from another country today. I'm in the US. He's in the country of Canada, right? Is that how you say it? Canada?
As Dean would say, Canada.
Canada. Yeah, sometimes I catch myself. It's Canada. It's Canada. Real Tooth Doctor 2.0. I have a question for you.
Go for it.
You're super famous, I know. So who's the 1.0? Like, who's the Real Tooth Doctor 1.0?
So 1.0 was actually hacked about, I think, 6 years ago or so.
You were hacked.
Oh, yeah. And I couldn't get it back. They were demanding, like, they wanted, I think, like half a Bitcoin or something to give it back to me. And I'm like, it's all yours. Enjoy.
How many followers did that have when it was hacked? Do you remember?
I think, if I'm not mistaken, like maybe 25, 30,000.
Still a good chunk, man.
Yeah.
That's some time.
And it was all organic. It had like very high
Yeah.
engagement. There was a lot of collaborative posts. So it sucked. And some of the content that was on there, I don't know why I didn't have it saved. So I
Yeah.
lost that content with it.
You lost that content.
But I learned from it.
Interesting. That's crazy that you were actually hacked and they're like, oh, no, you got to pay us to get your account back.
Half a Bitcoin.
Okay.
I'm like, who do you think I am?
I don't know. But yeah, today we have you on the show and we'll get into your story. And I know we both like taking teeth out, so we're going to talk about that too and some of our favorite instruments. So let's get busy.
Buttermilk biscuit, here we go. Sift the flour, oh, let's go.
That's a little Seattle rap for you from the 90s, 80s, 90s.
Amazing.
Way before you were born, probably. But Sir Mix-a-Lot, you've probably heard of him. Baby Got Back.
I definitely have. I've definitely
Put him on the glass.
Yeah.
Posse on Broadway.
I've definitely vibed with those tunes in the past for sure.
I mean, you guys got Drake and who else? Justin Bieber, is he from Canada? Ryan Reynolds.
Ryan
Is he
Reynolds,
Canadian?
Justin Bieber, Drake.
We got all the sweet people.
Yeah, we've got some pretty dope people here.
Maestro Fresh West from way back in the day. Awesome. So yeah, so you are an influencer, dentist. What are you? What's going on?
I don't like to call myself an influencer, but
I don't like that either.
yeah, I feel like for us in the dental field, I mean, unless you're doing like TikTok dances, which
Right.
nobody wants to see me
I don't do skits or dances.
Yeah,
Yeah.
I want to say I'm more of a content creator or
I like it.
educational content creator. Let's say that.
No, you definitely do educational stuff. It's relatable to a lot of people, and I think your story is interesting because you're not a restorative dentist, really, right? You do a lot of surgery, from what I can tell.
Yeah, I would probably say 70% of my practice is oral surgery,
Yeah, that's a lot.
but I still do a lot of restorative dentistry just because I don't want to lose those hand
Right.
skills. And I have friends that kind of do the same thing. They're much older than me, but one of their biggest regrets is that they didn't maintain some of those hand skills. And now they're like, well, gosh, I wish I could still cut a crown. Like, I haven't done one in 25 years.
I haven't done one since dental school, and I ain't no, it's like I don't want to do that. And so we got into it in the beginning. You're in Canada. I'm in the U.S. I'm in Seattle. You're based out of Toronto, correct?
Correct.
So how did you decide on dental school? I know how I did, but I mean, how did you get into all that? You have family that are dentists? Like, what happened?
Nobody in my family is a dentist. I mean, my mom's cousin was a dentist, and I had a
right, that's somebody.
horrible experience with dentistry. Do you want the political?
I don't know. Whatever you think is legit.
Do you,
I mean,
do you
whatever
want
makes
the
sense.
response that I would give to dental school if I was applying for a specialty program, or do you want the honest answer?
No, honestly, I mean, what drew you to dentistry?
So, actually, to be fully 100% honest and transparent, when I lived in Vancouver, I lived in a part of Vancouver called North Vancouver, and we lived in like right next to like Grouse Mountain, and it was a quieter neighborhood. We had a lot of neighbors or people that were of higher education level, let's say that.
Right.
And I had this neighbor who also, like, always had awesome cars. And I was a kid, like I was like 10, 11 years old. And like every time this guy, like every 6, 7 months, he would have like a different Mercedes. And these were like cars I had posters of in my room, right? Because
People had those Lamborghini posters and crazy posters growing up.
yeah, I mean, he always had like really super nice cars, and me and my dad were like very, very into cars. But growing up, like my family lost a lot when we moved to Canada, so we didn't have a lot of money. So it was always like a dream to be able to afford like one of those Mercedes and stuff. So one day I asked him, I'm like, hey, like, what do you do for work? And he's like, I'm a dentist. I'm like, wow, you buy all these cars with dentistry? He's like, yeah. I'm like,
Yeah.
well, shit, I want to get into that.
Yeah. I mean, that's fine. It's whatever it takes to like get you interested in, in that profession even. It's similar to me. Like my parents had friends that were dentists, and my parents aren't doctors or anything. And my mom was actually a nurse, but my dad was a laborer. And so they had friends that were dentists and they were doing really well. So like I remember like in the third, fourth grade, my parents, especially my mom, was like, you should be a dentist when you grow up. Because, they saw their friends who were doing pretty well at the time and they're like, you should be a dentist. I'm like, oh yeah, I'll be a dentist. So I always thought I was going to be a dentist. I didn't really know anything about it. Even in high school, college, I didn't really know much about dentistry. I just knew I was pre-dental. And because my parents said, you should do it because people do well. So very similar. You saw people do well and you're like, oh, I got to get into this. So that's cool. So you got into dental school. Did you go to dental school in Canada?
No, I went to Australia.
Oh, nice. How long did you live out there? Just for school and came back, or did you work out there?
No, I actually worked out there after I graduated because at that time I was actually dating somebody that was in dental school in Australia. So I was waiting for her to finish dentistry as well.
Yeah.
I think I was there for 7 years.
That's a good chunk.
Yeah.
Is dental school 3 years there or 4 years?
4 years.
4 years. Okay.
Yes.
Yeah. Same.
I did
So
4 years of dental school, and then I stayed back and worked for 3 years.
Yeah. And you, at the time, you were probably doing implants and all. I've seen some of your cases, like all on X type stuff you were doing, I think, right? And then you kind of gravitated, I think, probably over the years to the surgery side versus restorative.
So when I graduated from dental school, I was in contact with one of the Max Fax guys that was faculty at our school. And this guy was an absolute beast. He first went to medical school. Oh. Then after medicine, he went to dental school. And then
that's rare to do it that way, but people do it still.
After dental school, he did general surgery. And then after general surgery, he became an orthopedic surgeon. And then after orthopedic surgery, he became a maxillofacial surgeon.
This guy's got ADHD though.
But
something's going on.
But
yeah,
but
that's a lot of training.
He was a beast of a surgeon. And I remember him very well because when we had our oral surgery voice viva exams, which was you sit in front of a panel of oral surgeons, oral pathologists, pharmacists, and anything an oral surge or oral path, they can ask you. Anything under the sun. And I remember this guy gave me such a hard time during that exam. He said, oh, there was a patient that's been in a car accident and they've had fracture of this and this and this. And now they can't.
And these are dental students or dental graduates?
No, these are all so it consisted of 3 oral surgeons on that panel and 1 oral pathologist, 1 person from the faculty.
Yeah, but the people taking the exam are dentists, right?
Yeah.
Yeah, but they're giving you all this full body trauma cases and...
Well, worse. Okay. Mine was patient can't adduct or abduct the eye and he's got diplopia and all this stuff. So tell me exactly which nerves are involved and which
which muscles and
he went really into it. Okay, now tell me the path of this.
That's like face trauma. That's like oral surgery stuff.
Oh, yeah. So I looked at him and I'm like, dude, I'm like a 3rd-year dental student.
Yeah,
Ask me the branches of the trigeminal nerve. What is this?
I got the acronym down for that. Yeah, do that.
So anyways, after that, I remember the next semester I had him in my oral surgery rotations. I had him as one of the mentors and he said, I remember you. And I said, yes, I remember you too. He's like, I really pushed you hard that day, didn't I? And I'm like, oh yeah, you did. And he's like, well, how did you do? I'm like, you almost failed me for the exam. So it was tough. And then, anyways, from that point on, we kept contact. And when I graduated from dental school, his private practice, because he mainly did hospital dentistry or hospital surgery, and his private practice was actually very close to one of the offices that I worked at as an associate part-time right after graduation. So I started referring him some cases and I said, hey, I'm really debating if I want to do an oral surgery residency and I really want to come and start shadowing you a bit in the hospital. And it was quite a process because I was there on visa, and for you to have hospital rights, you need to have permanent residency. It was quite a process for the hospital to pretty much give me access to being able to come and see patients in the hospital under his supervision, I should say.
And this is in the late 2000s, right?
This is in, I think, 2018.
Mm-hmm.
And so it all started with just me shadowing him. And later
Well, that's cool that he let you do that.
Oh,
I mean,
yeah.
that's great exposure.
I
honestly.
I was assisting him in facial trauma and orthodontic surgery, cyst removals, cancer. Like we were doing it all, and I got firsthand experiences watching all this. And then
Yeah.
when it got to the wisdom teeth, when I graduated from dental school, I had this passion for wisdom teeth. And the reason was every morning I took the train to the hospital, and it was about an hour train ride. And back then, Snapchat was a big thing. Instagram wasn't.
Snapping on the train.
Well, what it was there was this surgeon out from New Jersey who was anonymous, but he was posting wisdom teeth surgery on Snapchat, and it was called the Bloody Tooth Guy. And I was so fascinated by this because I had never seen what an impacted wisdom tooth looks like, let alone watch it being removed. So I used to watch it every day, and gosh, it was like I was so fascinated by it.
So he started on Snapchat?
He started in Snapchat, yeah.
I've never even had Snapchat.
So
I didn't even get on Instagram until after COVID. Like I'm late. But yeah.
I think that's probably when a lot of dentists and specialists and all that really got into Instagram. It was just during COVID.
Everything went virtual pretty quick.
Yeah, pretty much.
Yeah. Yeah.
So I asked him if he would let me start removing some wisdom teeth under his supervision in the hospital. So what would happen is I would refer my cases for him to see in the hospital, but then under GA, I would be able to do the operation.
You're basically like a resident, first assist, the whole time. So the way the U.S. is, and most countries are probably similar. I mean, residency is like a mentorship, really. Like you're learning from a senior attending or senior resident. Like, that's most of your learning. And so you're kind of getting that informally. Basically, it's the same thing in a way. Like you have less responsibility with the patients because, you're not the primary, but you're getting that exposure and experience like a resident would get, essentially.
Yeah, I mean, I was like a fresh graduate, and I was assisting in amyloplasty.
You're like a sponge. You're just like, I mean, whatever I can do, because I know you're my backup. If I F it up, you're right here, right? All right, don't go too far. But yeah, that's awesome. No, that's really good. Yeah, because that's helpful. I was wondering how you got into all that. So you actually had training essentially with an established surgeon, but not just dental alveolar. Like he was doing a lot of crazy stuff. It sounds like. So that's great. He could manage the whole trauma almost. You got a broken leg and a hip and a ZMC fracture. You can probably fix all that. That's crazy.
Yeah,
that's pretty crazy.
Honestly, I don't know how he handled all that schooling, but this guy was.
When you're in it, it's just easy to get your head down and keep going. It's just. Yeah, that's because I did the 6-year program too, and it was just once you're in it, it's just you just kind of it's easy to I'm gonna get out and do another fellowship. It's just you can keep going. You can go until you're super specialized that you kind of like, do what you want. But I had to get out sometime. But that's awesome. So you came from Australia, then you ended up moving back to Canada too, and you went from Vancouver to Toronto.
Yeah, well, I had a lot of friends in Sydney, Australia that were actually from Toronto, and when you live in Sydney, Sydney's a very big, populated, busy city. It's like a city when you go out 4 a.m, there's still cars out, there's traffic, there's
kangaroos.
Oh yeah, not many in the streets in Sydney. But,
okay, all right. Fine.
But there's like it was a very lively city, and Vancouver's completely the opposite. And no offense to residents of Vancouver, but 7 p.m. when you're out in Vancouver, it's quiet. 1 p.m. maybe just a downtown core, but that's it. Like the streets are dead. I was so used to the big city. I was like, I can't do.
Toronto's huge.
Toronto's huge. Yeah, Toronto.
It's nice. It's fun there. Toronto's fun.
Toronto is fun. Yeah, I'm not gonna lie. Toronto is a very lively city.
It is. Yeah, I've been there a few times. It's awesome. So that's great. So you've been working and you've been kind of keeping up with surgery and especially impacted teeth. You do a ton of educational stuff on your videos and you're answering tons of questions. I mean, your account got huge. Like, I don't know how you do this. You post like a picture of you drinking some tea and you get 30,000 likes or something. Like it's pretty sweet, man. It's not bad.
It's
not
good
bad.
tea. I'm not gonna lie. It's got to be really good tea.
I'm like, I can't do that because nobody wants to see my Trader Joe's fish sticks. Like nobody. I don't know. I'm gonna show anyone that. But that's awesome. That's awesome. And so you're back. You're doing a lot of extractions. You're doing educational stuff online, which is awesome. I was gonna get into some cases and some instruments that we use. I think that'd be kind of fun. I've been performing full arch dental implant surgery since 2012. I started back then with Nobel implants and I continue to use them today. Getting consistent results over time and seeing these restorations in function over that length of time has basically strengthened my use of the product. There's over 100 implant systems out there. I just choose the one that's been the most consistent for me. Fun.
Let's do it.
Do you wear your blue gloves? Those are your thing, right?
Well,
your blue gloves. I got
Originally,
these. I usually wear these green ones.
originally was blue, but recently some of these clinics are ordering me pink gloves. So
Oh, hey.
I don't know what's going on. And Dr. Jess, if you're watching this, please come on. let's stay off the pink for
These
a
are
bit.
my ideal. I like they kind of pop in the black and white videos. That's why I like them. I'm gonna open this thing and I'll show you some stuff here. Give me a minute to open this thing.
Yeah,
Up.
take your time.
All right, let's do this. I was gonna ask you some questions here. I'm gonna get this guy off the notes. Do you have like your favorite elevators? Periosteal, like what do you use to raise the flap?
I use usually for my elevator. I'm a Malt 9 guy.
Yeah, is that like the periosteal, right?
Yeah, just a regular periosteal. And to be honest, because I do surgery out of like 8 or 9, yeah, that's the one. I do surgery out of 8 or 9 offices, so it's sometimes you just get what they give you, unless I take my own
Right.
instruments. For implants, I like to use like the very small papilla elevators.
Yeah.
Especially in like
I like this one. It's a Woodson elevator.
I've seen you use that a lot. And one of the
I use it on every, yeah.
one of the surgeons I actually work with, her name is Dr. Leslie David. She actually loves that. That's all she uses.
Yeah, I rarely use the periosteal, the number 9. When I'm doing big flaps and things like for full mouth or for all on 4, sometimes I'll switch to this because it's just bigger. But for everything, I just kind of use this little guy. It has this tiny little tip on the end, and then this curved part is nice for scraping off flaky bone, off little impactions, just getting in there, and sometimes even granulation tissue. So that's nice. So yeah, you like the Molt, I like the Woodson. Everyone's different. 10 oral surgeons, 10 dentists are going to take teeth out 10 different ways. It still works, you know. So
I've actually never used the Woodson. I really want to use one.
oh yeah, hey, I like it. I feel like it's just easier for me to get in there and quickly lift it, and then I don't know. I'm just used to it now, I guess.
But you know what I really like about the Malt 9 is the wider blunt end. I use that to retract and protect the lingual flap when I'm doing my osteotomy distal of the eights. What do you use for that?
I don't usually put anything back there too much. I don't know. If the tooth is trapped back there, sometimes you do the chopsticks with the 2, but I generally don't put much back there. I use it to lift the tissue up, and I just hold it there for a few seconds, and then it just it's more lax, and then I can usually, but yeah, I don't usually throw anything back there too much. So yeah, so that's your elevator of choice. Do you use the flat handle blade, or do you like the round one for the bar for your 15?
So to be honest,
Does it matter?
I use the flat, and
Yeah.
even though the round handle is so much easier, it's just when I was doing my hospital training back in the day, that's what I got used to. And it's like, I don't know if it's like a comfort thing or like,
Yeah.
I don't know, some kind of OCD trait, but I like, even though the round handle is so much easier to use, but if I have both on my tray, I'm still going for the flat, even though it's more difficult to use.
I'm way opposite. I'm like, I got to get the round, and my staff knows if I get the flat on there, they're like, "Oh, so sorry." I'm like, "That's okay. I'll use it. It's all right." I love the round one. I just feel it's like ergonomic for me. It's like holding a pen or a pencil, and you just kind of get around the teeth easy. I don't. That's why I like it.
Much easier to use.
Yeah. Obviously, you use the Minnesota, right?
Yeah.
That's pretty. In Canada, you guys have these. What do you call them?
They don't make it north of the border.
Okay.
They're being tariffed right now, so
Yeah, obviously, I heard you talk about aspirating, before you inject. Obviously, aspirating syringes are helpful. That's all standard 27 gauge needles or whatever you're using. What's your first elevator for a tooth? Do you have a small straight, or like a 77R? Like, what's your first one, or spade?
I feel usually for lowers, I'm a 77R guy.
Yeah.
Some offices, they have the spade elevators, like the offset spade.
77R. It has that little bend in it.
Yeah, I feel like it's so easy for like sectioning mesioangular impactions, and I feel like it's also, you get it in at a very good angle to elevate from the mesial portion of the tooth. So I think probably 80% of my cases I do with the 77R.
Yeah, these are both 77Rs. Yeah, I like those too. I always start with the spade. Like, for whatever reason, every tooth, I start with that offset spade, and this is the Bernard spade. It has that offset like a R. The curve of this is interesting. The curve of the spade has to be this way, though. Like, you can, when you buy them, there's a reverse spade and a regular one. If you get the reverse, this concave edge of it is the other way, and it's only useful for a couple different scenarios. So, I mean, we have one reverse Bernard spade, but the rest of them are like this. So if you ever buy the Bernard spade, make sure it's not the reverse, or it's the side you want the concave side on. Because if you buy it and you get the other one, the reverse, by accident, or they don't call it reverse, they just have it reversed, you're going to, oh, this sucks. You got to make sure that concave end is on the right spot. So that's what I use this for every tooth. Like it's my go-to for every tooth.
I love using
To
that
start.
for upper sixes, or what's your numbering? It's like number 3 or something.
Yeah, first molars.
Yeah, so
Let's just say first molars.
I love it for the first molars, and
Your numbering is weird, man. I don't know.
well, I like to say that the majority population of the world goes by the FDA.
I know, I'm just joking with you. It's stupid. Gallons is stupid. It's miles are dumb. It doesn't make any sense.
But also the
yeah.
the offset spade, I feel that it's really good for soft tissue impacted upper eights. Like
Yeah.
perfectly fits on that mesial side, and you get that nice pop.
Sometimes you can roll them out just with the spade. Ideally, though, just for people that aren't used to using it, be very careful with the spade when you're doing front teeth if you're using it, because you can start elevating and all of a sudden it just impales the patient like into their nasal floor. Like that's dangerous. So you got to make sure you got finger rests if you're ever using it with front teeth. But for back teeth, because it has that cool offset, you can get in there and use it as your first elevator to create a little bit of space for your next wider, like 77R or whatever else you're getting back there. That's how I feel about it. It's like the first one to dilate it just a little bit, and then you can use your next bigger elevator if you need it going forward. I rarely use like the big. There's like 2 straight elevators, like the small and the bigger one. Sometimes I use the small one, and sometimes I use the bigger. Rarely I use the bigger one.
What
But
do you
I'm
use
always
them
like
for?
if the tooth is not moving at all. Sometimes I feel like I can try a different elevator, because sometimes if you just try a different elevator, the force from that elevator is different, and maybe it helps a little bit better. Just trying everything, because sometimes you get that tooth that's just not moving. You get that little trickle of sweat. You're like, oh man. You look at the clock. You're like, this is
You've
gonna
got
take a
like
while.
20 minutes till your next case, and you're not even halfway through.
You're not even. This is the first tooth, and it's just not moving. You're like, oh, man. Then you got 3 more to go. You're like, this is. Start swearing to yourself, basically.
The only time I jump to that straight that's that wide is for an erupted upper 8 in an adult patient when it's solid ankylos and I can't get any
Yeah.
mobility. And I just wedge it in between the 7 and the 8, the second molar and the third molar, and just give it a small few like twist motions and see if I can get even the slightest amount of mobility.
That's usually when I use it, when it's like not moving, and I'm like, I just need to do something else. This is taking a long time. Yeah, those teeth are tricky. And I was going to ask you later about specific cases, but yeah, erupted wisdom teeth on patients that are older, even past 25, are some of the worst cases, I think, to do. I rather do impactions than erupted thirds, like on an older patient a lot of times, because those are a pain in the butt to get out. Or you sometimes even get moving, or that tuberosity moves with that upper tooth, and you're like, or it comes out the palate, and sometimes you get that little laceration that's just from that tuberosity. It's just, they can be a nightmare.
I actually I didn't have one of those, but somebody called me and asked me to kind of go and help them out of a wisdom tooth case that they kind of got in a little bit of hole in. And when I got there, and the patient was like super cool about it, like they didn't say anything, but I just saw half the palate was open. The buccal plate was completely gone, just laceration like through that palate. The tuberosity, it was a big tuberosity fracture.
Yeah. No, I've seen those. They're scary because all of a sudden you're elevating and you're like, oh, now it's moving.
But then
You don't realize at the time the whole freaking palatal section and tuberosity are also moving with it.
yeah.
Until you tried to get it out, and then they're like, oh, and then all that tension back there. You're like, then you got to try to separate all that. That takes forever, because it's pretty far back there. Yeah, it's those. If you've done enough cases, you know what we're talking about. If you haven't done enough cases, just don't go crazy elevating back there with older patients. Just take your time. So that's basically what we're trying to say.
And don't put a forcep on it right away. Like the number of time I've told that to younger dentists, and I see they've put a forcep on this upper 8, and they're like putting a lot of force, and I'm like, that is a one-way road to a big tuberosity fracture.
Yeah, and just root tips breaking. Then you got to, it's just, they're not even mobile at that point. You just got to really get them out of there. I have a favorite forcep that I like. I use it almost on every tooth. Uppers, lowers, it doesn't matter. This is a 962 forcep. It has this S curve on it, which I like, and has these little grippers on the sides. You see, that's nice for your little grip on there. Serrated beaks, which are cool. And then, so you can use it for lowers, like that. If you want an upper, just turn it around and it's angled up nicely. I like it for most every tooth. I try it out. I pretty much use it on every tooth. So that's my favorite. I don't ever use the 150s or 151s, like ever. Some people love those. I just can't use them. When I use those at forceps, they always slip for me. So I use this one.
I think out of maybe the few thousand extractions I've done in the last couple of years, probably I've put a forcep on a handful of them. Like, I don't know why. I don't like using forceps anymore. I mean,
Yeah. Do you section everything?
I section. Like when I went through implant dentistry and did the training on all this atraumatic removals and stuff, and now everything I think about when I'm removing a tooth is like an immediate implant. So I just make life super difficult, and I section everything. I section.
How are you taking out a premolar and sectioning that usually? You're just trying to figure out if it has two roots and then where you section, and then
So if it's got two roots,
sometimes it's hard to tell.
Yeah, if it's got two roots, I will usually do a section,
Just
but
a horizontal.
yeah, I would do a horizontal, but then depending on how thin the buccal plate is, if I'm worried that if I section it, I'm going to actually pop that buccal plate,
Pop.
I will actually
Right.
do a different, I'll do like a cross section
Like
as
a
well.
plus, like a
yeah,
plus, yeah.
Yeah, I'll do a cross section, and then
Just quarter it out, just basically as much as you
I
can.
make my life super difficult.
What burr are you using for that? Like a 701?
Usually
Something
a
like that.
701. There are these periosurgery burrs that I have at some of these offices, and it's called, I think it's like
Yeah.
a 557 or something.
Is that even thinner than a 701? 701's pretty thin.
These are very thin, and one of my buddies who's a periodontist, because I always criticize him, he always criticizes me, we always
Why not?
bust
Yeah.
each other's chops. I tell him, you take way too long to take a tooth out. And if we're doing a case together, I look at him, I'm like, are you going to do this year, or am I going to be here all day? Like, I've got places to be. I can't take 45 minutes to remove one molar.
Yeah.
But he's like, he wants to preserve every like millimeter of that bone and that tissue and all that. And I'm like, come on, let's get it going. But one thing he's taught me, which actually really helps, is he has these very fine stiletto burrs. They're carbides, but they're super thin. And I actually found that it helps in older adults that have like fully erupted wisdom teeth or molars. And you don't want to like fully, remove that buccal plate and drill it off.
Yeah.
You can actually slide this burr in between the root and the bone. And
Like in that PDL space.
yeah, and you can do a very, very, very thin trough, but still keeping the height of your bone. And it's,
Right.
it's great for removing ankylosed teeth.
Yeah, I do that a lot with the 701. I feel like, that's helpful, saving the buccal plate. Pretty much every tooth I take out, I don't remove buccal plate. I do everything I need to do without it. Even if I'm not placing an implant, I just don't want to remove that buccal plate. Sometimes it's unavoidable because it's so attached, so thin. But that's the goal, is not to remove any buccal plate. So that's great. So that's cool. You take most teeth out without using forceps. That's awesome. Yeah, I don't use one of these 151s. When I use forceps, it's usually that 962, like I said. Premolars, front teeth, sometimes the ash forcep. I like that. You can just twist a lot of times and get those out with that. It's a pretty standard forcep in most dental schools, so that's nice.
Sums
And
up
then,
my third year of dental school.
Yeah. And so like that's nice. And I mean, cow horns, I still use cow horns. I think they're super handy when they're needed. Sometimes they can like ghetto section a tooth. Like you just put it on there and it
just squeeze
snaps
it.
both roots in half, and you're like, that's the ghetto section. It's already sectioned. Right? Yay. That's what I call it. It's a pretty ratchet way to section a tooth,
That's
but
funny.
sometimes it's inadvertent and it works. And sometimes you get it out and just one whole root comes out and the other one's still in there. It's not a big deal. So sometimes you get half of the tooth out with it. It's fine too.
I find cow horns are the best tool to use when it's an endo-treated tooth and there's a crown on it. You especially
Get the crown off.
it just boop, just
Pops
pops
off.
it right off.
I'm like, yeah, you're going to hear a little click sound. There
because
it is.
otherwise you're going to
Okay.
be sitting there for 30 minutes trying to cut through that crown. So
Oh yeah, sparks, or whatever the hell you're doing. What drill do you use, by the way? Is it like an impact air?
So I use a Sergier, which is your high-speed reverse exhaust surgical
definitely
handpiece
reverse.
for horizontal impactions, and for upper impactions, full bony maxillary wisdom teeth. I use an electric handpiece under saline, but for mesioangulars, some offices, there's one office I go to, their surgical suites are top notch.
Yeah.
They have that electric handpiece ready to go set. One of the offices I go to sometimes to do some cases, it's actually an oral surgery office. They have the Hall drill with the,
We used to have those.
Yeah.
Even in residency, like we'd even use them. We had them in case the electric ones, didn't work. But they're loud and they vibrate
loud,
so.
and it just
and then
sounds
that thick nitrogen cord. Like I used to tell patients, yeah, you're going to hear a little noise. and you're like, yeah,
You feel like you're in a pit
so
stop
loud.
in Formula One, just trying to pop these tires
Yeah.
off.
Are they the foot pedal ones, or do you got the little
No,
the hand
the
thing?
hand one.
Oh, I hate those.
Yeah, so I like.
We have those in the hospital, and every time I go there and have to use those, I'm like, man.
Yeah, that's exactly what I actually use in the public hospital system, but then I hadn't used it in private practice forever. I mean, most of the oral surgeries I went to was like an electric handpiece with saline.
Yeah, everyone's switched to electric, yeah.
But some of these offices, they still have them. And look, I mean, they do orthodontic
I mean, they're high
surgery
torque.
and
They're
stuff,
high
so,
torque, yeah. I mean, there's nothing beats the torque on those, but the vibration, like you're trying to do a local with those, it's scary. You know, and people in the waiting room can hear them. Like, it's bad. It's like, that's bad. Yeah, this is another forcep. I don't use it that often. One of my partners uses it for almost every tooth. I don't know how. It's a 222. It's like this little stubby one. But sometimes when people can't open very wide, you can get it on the very distal tooth or the upper one or the lower one to remove the tooth. It's a 222 forceps. So they're in the tray for those special things, especially with upper teeth way in the back. Sometimes they just don't open enough, you know, to get that regular forcep on them, to grab them enough to get them out, even if they're loose.
I've actually used that forcep a lot when I've sectioned lower first molars, and there is one root with the crown that's just not elevating. I just grab it with that and just give it a few twists, and it pops right out.
Yeah, that's awesome. This one I use a lot for purchase points, just the Cogswell B elevator. Yeah, this one's nice. It's just nice to have in the tray. You know, if you're doing something like that. Some people take out upper wisdom teeth with this one, like impacted ones.
I have.
Get it in there and
I've done that in the past. Not my favorite tool for it, but sometimes you just, especially in a case where
if they're high, sometimes it helps to get that little spot. Yeah, then you can get your pots in there.
Because sometimes what I'm worried about is, especially if the tooth is just sitting right on the sinus, I'm always like
pushing it up.
Yeah.
You want to get above it to push it down. You want to keep that force going towards the mouth. Yeah, that makes sense. Or the worst is going distally somewhere up, which you don't want to push it up in the infratemporal
fossa
area. Yeah. So, and then the pots, like, you know, there's usually a right and left one, but yeah, they're helpful for those really high wisdom teeth. You know, you're right. You get above them and then you try to curl it down. Yeah, twist your wrist and try to push it down, not up into the sinus, basically. But the pots are nice to have around.
When I was actually in the hospital doing that surgical residency, we actually had a case that was referred, and the dentist had pushed the tooth into the infratemporal fossa.
Yeah.
So that was a very interesting case.
Yeah, I've never seen that. I've read about it and I've heard it happening. I pushed a tooth once when I first started into the buccal space in the cheek. And like, you don't want to like go digging around in there blindly. There's like facial nerve and stuff in there. So what I ended up doing was waiting about a month or two until it kind of settled somewhere and you could actually feel it like here and inside the mouth. I made a little incision inside the cheek and I was able to just pop it out. At that point, I mean, it was way over here, like on the inside of the cheek. It moved into the buccal space. Yeah.
Wow. How?
Yeah. So it's just when you're elevating up there, that's the path of least resistance for it for whatever reason. It disappeared. I'm like, where'd it go?
Oh boy.
It wasn't in the sinus. It wasn't in the infratemporal. It was in the buccal space.
Wow.
I know. So now, ever since that, like, you know, you say when you do a lot of cases, you see a lot of stuff and things kind of shape and mold how you practice, you know, as you go through. And that definitely did, because after that, I'm like, you know, if I see that fat pad up there, sometimes you're taking a tooth out up there and that buccal fat pad comes out, right? Then it's all over the place. It's hard to like retract. So I'm like, you know, if it's over the tooth and I can't see the tooth, we'll just wait. I'll just close up and say, you know what, let's wait a couple of years for that to drop down some more. We'll get it done. So that kind of shaped a little bit of how I treat those cases now. But that was like 17 years ago, you know, and that kind of shaped the way I kind of do things. But yeah, it definitely can happen. I've seen it happen once. So
I remember in that case that the tooth was pushed into the infratemporal fossa. We actually waited, I think, 6 weeks to get some fibrosis around the tooth so it stabilizes before the surgeons went in there.
Yeah, and they went in the operating room probably to
we did it under GA.
Yeah. There's things in there you don't want to mess around with. So that's helpful. But yeah, that's great. I mean, there's the other things, typical stuff, curettes and bone files. You know, it's pretty standard stuff in most trays. It's just a bone file. And what else do we use?
That's one thing when I see missing out of a surgical kit, it really irritates me.
I know. It's like whenever you want it, it's like not there, or it's not in the tray. They have it on the side somewhere and they have to dig through a bunch of other instruments to find it. Root tip picks, we have like a smaller one and a little larger one, but just basic standard.
Yeah, those are part of my hourly practice.
Do you have the thin handles or do you get the fat handle ones?
So I have both.
I don't think I like the fat handle ones better. It's kind of like an elevator. Like it has that handle like this
Yeah,
almost,
yeah.
right? And then it has that little root tip pick in. I feel like you can get more leverage.
Especially for lower wisdom teeth that are like 3 roots or 4 roots. Some of the
sometimes,
ones that, especially if the root's kind of perforating the lingual plate, like there's a communication with the submandibular space.
Yeah.
Like if you, God forbid, if you put that elevator on top of the tooth,
You push it.
like
Disappeared.
it disappears, right? So
It disappears. Yeah.
what I usually do is in those cases where I as soon as I touch the root and I see a small little bounce, like it's about the thing,
Well, some buoyancy for it. Yeah.
then what I do is I actually take the spoon, the little spoon,
Like a curette.
and I put the curette actually
Curette.
on the lingual of the root, right in between the root and the lingual plate. And then I grab that fat handle root pick, and from the mesial, I lift it up. So I kind of do the chopstick technique on it. But
While your assistant's retracting for you.
yeah, but I find that
Yeah, because you can't do all that to get by yourself.
sometimes in surgery, you
With my
feel
fourth
like,
hand, I get in there and
no, so
Yeah.
honestly, sometimes I feel like I need 2 more hands when I'm doing some of these things.
I know. You're like, hey, you got to hold it right here. Then you got to do this. And then sometimes their tongue is in the way. Someone have to hold their tongue back. There's a lot of stuff going on in there sometimes.
Sometimes I get mad at my
Only so
assistant.
much
I'm like,
room.
suction, please. And I keep forgetting the poor person is like holding the flat back and flushing the saline on
Yeah, they
my
might have
burr.
2 things on 2 different fingers doing 2 different things at the same time with one hand. And then, so it's crazy. It can get crazy, especially when people have hyperactive tongues and they're just all over the place and they can't control it.
Or if the
That's the
tongue, if
worst.
they've got a fat tongue that's sitting over the dental arch
Yeah.
and you're actually working underneath the tongue. My nightmare, and I saw this firsthand once in Australia. There was one case, it was a full arch course for where you kind of did full arch of implants under GA in a private hospital. And I remember we were taking turns to assist and all that. And we were using the Hall drills in the hospital. And there was a case that was like that. And the dentist was trying to do their osteotomy on the lower ridge and flatten it out, and the assistant was holding back the lingual side of the flap with the tongue. The tongue was a little bit big, and she was using a lot of force to retract it, and all of a sudden it slipped, and she actually caught the floor of the mouth and the ventral surface of the tongue in the Hall drill. And I just saw literally the floor of the mouth like
Blow
deglove.
up quick.
Like it was the scariest thing.
Yeah, especially if it's a Hall drill. Like that's like the worst one. It's so torquey. That definitely. I've seen even referrals from like dental drills getting into the floor of the mouth and bleeding everywhere to refer to the oral surgeon and help out. The tongue, obviously, too. That definitely happens. I mean, it's crazy. It doesn't happen more often than it does because it's definitely small space in there, and people swallow and their tongue moves all the time. Do you stand up or sit during your surgeries?
Stand up. I can't.
Yeah.
I can't.
All right. Yeah. I gotta try sitting. I feel like I'm getting
can't
old
do
now.
it.
I need it. Maybe some people do it. I'm like, how do you do it? They're like, oh, it's better. Once they do it, they're like, oh, you should do it all the time. I still stand.
No,
I wear compression socks and I stand. Whatever.
Yeah, like when I was in the hospital, we used to do like 16 to 18-hour days, and I remember I just stood on a stool the whole time, like a little step stool, and that's like how like that position is what's stuck in me now. I can't sit, and even for restorative dentistry, I stand a lot.
Yeah. I teach at the dental school. It's volunteer, but I'm affiliate faculty there. I've been doing it forever. And some dental students want to sit and do it, and we try to teach them to stand, while they're in the rotation, just to get the experience and see what they like better. But and they don't use throw packs. It's just everything. Yeah, that kind of stuff. But that's cool. You stand up. That's great. Do you ever sweat during a case? I rarely sweat in surgery, except if things aren't going right for an extended period of time, where there's some anesthesia issue, they're coughing, there's like they're laryngospasm, like what's going on. But sometimes you feel that you've got a case that's just not going your way. Roots are breaking, the patient's coughing, whatever it is, and you get that little trickle of sweat. Sometimes you start like, oh man.
The worst for me is this actually happened to me. I think it was this week or last week. Gosh, what was it? It was a horizontal impaction on a patient in their mid-30s, and it was a very large tooth, but this person had a very relatively smaller jaw. So my biggest worry was about a jaw fracture because of the size
Yeah.
of the crown and how much space it was taking within the
Right.
mandible.
Right.
So I was already a little bit nervous on this case, and the patient did not want to do sedation. They wanted to do it awake for financial reasons.
Right.
And I decided to do it under local anesthetic. And you know when sometimes that section just doesn't go the way you planned it to? And
Yep.
all of
Yeah,
a
yeah.
sudden you just made things 100 times more difficult.
Yeah.
So what I usually do is like when the crown is that large and the jawbone is not super thick on both sides,
Right.
I like to kind of divide that crown into 4 sections before I do any elevations because I'm always scared I'm going
Right.
to put too much force and
Right.
God forbid have a jaw fracture.
Mandible fracture. Yeah.
So I divided the crown into 4 sections and I came and put my elevator and I did what I always do. I just gave it my twist and
click.
the buccal pieces fractured off, but the lingual didn't.
Right.
And the tooth was tipped more towards the lingual. It was actually
Right.
more lingually placed compared to the second molar, and it's a full horizontal.
Mm-hmm.
I'm like, shit. Now what?
Sometimes you just hear the click, and you by the sound of the click, it
it's
wasn't
not,
a good
it didn't go the way you want.
one. It's like a little thin, hollow one. Click. Or like,
And you
That's
just
not
see
gonna
like a
help.
little flicker of enamel just pop off.
but I always make a joke now. I'm like, well, that'll help. I'm glad I got that one out of there. That piece out of there. Yeah. You hear the click and
So, I mean, look, the case went like, let's just say we finished the case and no jaws were fractured.
Some cases are going to be struggle, even for oral surgeons. Trust me, they're going to be struggle buses. Like it's just teeth can humble you, no matter how good a surgeon you are. I don't care what people show on Insta or whatever. That's why I always show cases where I show real cases. I think where roots break. How do I do this? There's bleeding. That's what happens. And some people comment, "Oh, there's never bleeding. I never seen that bleeding." I'm like, dude, you haven't done enough cases and you're
to
just
see it.
lying. I mean, come on. It's just the trolls are just out there, right? But it's just part of it. But yeah, that's definitely, yeah. So I definitely can sweat on cases. I rarely sweat during surgery, but and sometimes it just happens. It's like, oh, you feel that little drop, the first drop, and then it's like, you broke the seal. So I was going to ask you some rapid fire stuff here at the end. All right. So about your country, where you're at, do you get your milk in like bags or in cartons. Or like how do you guys get there's no bag? I thought Canada had bagged milk. Is that a thing?
Costco only has bagged milks.
What the frig, man?
Honestly, I haven't shopped for milk in a long time. I mean, my younger brother, he's probably the only one in my household that drinks milk. I don't do the milk shopping anymore, but it's always in a carton.
Okay, good.
I've only seen bagged milk in Costco, and they come in like 4 2-liter bags, and I just look at it and I'm like, who drinks all this milk? Like, that's 8 liters of milk in a bag.
I don't know. It sounds ridiculous.
And what do people do with bagged milk? Is there like a container you're supposed to?
Yeah, you're supposed to have a special bag container for the bagged milk. You guys have butter chicken pizza, right? Is that pretty good?
I've never had it, but that does sound tasty.
Yeah, I mean, I don't like the chicken. The butter paneer, the cheese one version, the vegetarian version of it, it's pretty good on pizza. I've had one of those before. It's pretty good. Yeah, it's actually pretty good.
This is the first time I'm hearing about it.
All right, ice wine, is that a thing?
No.
Okay, all right. You don't have that at your parties?
Actually, let me just tell you this. In summertime, there are some restaurants that will actually serve you really chilled red wine. But no, I've never actually had ice wine.
All right. Let's see. Do you like maple syrup? Anything maple?
I love maple syrup.
You guys are just...
Have you had maple, like real maple syrup?
I mean, I've tried it. I even got a maple syrup bottle, like looks like a maple leaf from Canada. I don't know. I don't like syrup that much, to be honest with you, but maple flavor in general, not so
Only
much.
with waffles and pancakes.
All right. I mean, I don't mind maple bar donuts, I guess, but I don't think that's real maple. I don't know what they put in there. Tim Hortons or Starbucks? Or neither?
Starbucks.
Really?
Yeah, Tim Hortons.
Tim Hortons.
It's really bad. I mean, look, if I'm in a pinch and I absolutely like need a snack or a donut or coffee, like I will 100%. I'm not gonna lie, I'm 100% going to have it and probably enjoy it. But if I have the choice, usually I'll stick with Starbucks.
All right, cool. What's your favorite cologne, man? What do you like to?
Up until recently, it was just Creed. I use Creed Silver Mountain Water and Creed Aventus.
Someone else told me about that. I've never smelled it or tried
It's
it.
a very fresh smell.
Okay. I gotta check this out because I've had a couple people mention that now. Like I'm like, all right, I gotta check that out.
Well, the Aventus, I mean, every guy that I
Aventus.
know is wearing it, but
Oh really?
the Silver Mountain Water is more of like a little bit of like a refreshing smell. It's more citrusy. But
I don't know if I like citrus because I feel like in our office we have like in our staff bathrooms and our bathrooms there's like an orange spray. It's like if you go to a bathroom and you smell orange spray, you know someone just dropped a bomb. And it's like so anything with orange or citrus, I'm like I don't want that.
no,
on me.
no, it's not. It's
I'm
not
gonna think
orange.
I just freaking dropped a bomb, all the time. It's like no thanks.
No, but no, go sample
yeah.
it, go try it out because you will.
I know I will.
You will like the Silver
Yeah.
Mountain Water. It's like a very refreshing
All right.
smell. But recently,
Yeah, I've heard this now a couple of times.
I've switched to Louis Vuitton Ombre Nomad. I think I might be butchering the name. It's very strong. It's got some like oud and tobacco and those kind of scents in it.
All right.
But it's like a very masculine smell. I don't know. I like it.
Got it. I have an old go-to Jean Paul Gaultier, the torso bottle.
I used to have that.
That thing is.
Yeah,
That thing is still legit. That's still legit to me because it's. I've never had any complaints, but it's been good. So I'll try the Aventus though. I gotta go look. I gotta get something different. And like your casual shoes, like what is your go-to? Like Golden Goose, like what are you popping? Dunks?
Casual, like how casual are we talking about?
Just walking around town. I don't know. Not really going anywhere special.
So my work shoes are usually like Air Maxes, Nike Air Max.
Okay. Yeah.
Dunks don't do well with my feet. I don't know why.
Yeah, they're too wide on mine, and then they're
It's
not
just very
comfortable.
flat.
Yeah, they're not comfortable.
My going out shoes, please don't judge. I am Persian. My
Louis Vuitton, Gucci?
my Louis Vuittons
Okay.
are like I have like 6 pairs of Louis Vuitton sneakers.
Yeah.
They are
Yeah.
probably one of the most comfortable shoes I've ever had.
Okay, I don't think I've ever tried their sneakers.
They're called Louis Vuitton runway running shoes or whatever.
Are they still red bottom sneakers?
Oh yeah.
Like the sneakers? Oh, everything is?
No. Well, that's Christian Louboutin.
Yeah.
Yeah. I went through that phase with Christian Louboutin. I had but now I don't care about like the style. Like
Yeah.
before
They're just comfortable.
10 years ago, I was like, I like to be really stylish and really dress up everywhere I went. Now it's like whatever I'm most comfortable in. Like
Yeah, I'm like
I
that
have
now,
like
too.
no care in the world.
I'm in my hermit hoodie phase right now, I guess. I was going to say here, this is funny. I still get patients from Canada and they still say frozen. When you inject people and you get them numb, do you say, I'm going to freeze you? Like, how does that work?
Yeah, I do.
Is that still a thing?
Yeah.
So how do you say it?
I'm like,
So I say, I'm going to get you numb.
well,
do you say?
I just say I'm going to give you a little bit of freezing.
See, I knew you guys did that.
Well, like in Australia, I would say like we're going to give you some anesthetic. You're going to feel numb. But in Canada, they just call it freezing. And
Everyone calls it freezing.
yeah, well, I feel like it's mentally for a patient, the word freezing is more comfortable compared to anesthetic or numb.
Okay, got
It's
it.
like a psychological effect that has on people.
Yeah. No, okay. No, I mean, that's fine. I'm just curious because I didn't know if I knew it was before. I didn't know if that was still like a thing.
Oh, no, it's a
It's a thing. I'm going to freeze you now. Okay. Oh, interesting. I'm going to try that one day. Do you like Smarties?
No, I actually don't anymore.
All right, good. I don't like them either.
Is
Ketchup
Smarties
chips.
Smarties a Canadian thing?
Candy. Yeah.
No,
It's candy, right?
it's-
chocolate. Isn't Smarties a candy?
It's a chocolate.
It's Canadian.
No,
Yes.
Smarties is
It's
Canadian.
got to be. It's got to be. Yeah, I'm pretty sure it's Canadian.
Oh,
I mean, I can fact check it later. What about ketchup
can the
chips?
producers please fact check that?
I don't have the staff here today. Fact check
Can we
it later.
please fact check that?
Yeah.
Ketchup chips, they're awesome.
Ketchup chips.
Awesome.
Really?
They're
I've
awesome.
tried them. I can't get into them.
No, they're awesome.
I know you guys have like pickle chips too. I don't know. But
Pickle chips. I think I probably.
okay, what's with mac and cheese in Canada? Craft dinners. Don't they call it craft dinners or something?
I used to do it when I was like 5-6 years old. Now,
All right. So
But you know what? There are places that like sell like high end mac and cheese with like chicken
Yeah.
on it, beef on it.
yeah. I mean, you can get it
toppings.
like at a fancy restaurant with like lobster in it. And,
Oh
like,
yeah, for sure. Like sometimes.
Right, but I didn't know like craft dinner was a thing. Like craft.
Wait.
dinner.
You guys don't have craft dinner in the States? You're joking.
I mean, I don't think we call it that, but also it's not like a family dinner, mac and cheese. It's like a kid's meal.
Well, it's
Right.
kind of like a kid's meal here too.
It's like, okay.
Come on, guys, we
chicken
share a very
strips, little
small
chicken-
border.
Little chicken strips and Kraft mac and cheese for dinner tonight. Guys.
Honestly, I haven't had mac and cheese in so long. Now that you mention
all
it,
right.
like it's overdue.
All right, the last one here: Coffee Crisp candy bars.
They're delicious. They're absolutely delicious.
No, I can't get into those either. I made the mistake once of telling someone who brought them as a gift. I tried one of them. I'm like, oh, this is great. Just being nice. And the next time the person came, she got like a carton of them for me. Like, I know you like these. I'm like, thank you.
Well, we used to get it.
You know?
Like Costco used to
Great.
sell those variety packs for Halloween.
Yeah.
And every time, like, I would just go straight after the coffee crisps. They're so good.
Got it.
It's like a wafer
they're
in the
not here
middle.
at all.
Like, you can't go wrong.
Sometimes you can get them at like Cost Plus world markets, but nowhere else really. But yeah, man, I want to thank you for coming out. I really appreciate it. This is a long time in coming, and I like your setup.
I know.
It looks good, sounds good. It's gonna be good. It's gonna be good.
No, it's awesome, man. Thanks for having me. Honestly, I've
Thanks
been
for-
wanting to do this for a while.
No. Hopefully, it's the first of a few down the road. But yeah, good stuff, and I will edit this up and shoot it out.
Yeah, for sure.